a Social Development Department report into the implementation as well as the utilization of the COVID-19 Relief of Distress grant has found that over 3 million people who qualified were actually excluded. Some of the reasons cited include lost ID documents and the lack of access to smartphones. For more, we're joined now by the Executive Director of Clermont Analytics, Dr. Wiseman Magasela. A very good evening to you, Doctor. Thank you so much for your time today. So as we go through this report, first of all, let's talk about issues of exclusion. How come, apart from the two reasons that I listed in the introduction, were so many people who were actually supposed to be beneficiaries of this particular scheme actually left out?
Good evening, and to you, and good evening to your viewers. Now, I do not think that the story only begins with the 3 million or so that were excluded. I think the issue of what we call the digital divide, instances where a number of citizens of many poor countries do not have the devices to connect online, lack the resources to connect online, such as data. Even in certain instances, you'll find that they're not even able to connect to the local mobile networks. So we need then to locate the challenges that SASSA faced first, along the lines that this is something that does indeed happen in many jurisdictions, in many instances where digital platforms are utilized in the payment of social grants or in the provision of social assistance. So this is not really unique per se to SASSA. It does not necessarily reflect a failing on SASSA as an organization, but these are issues that are structural within South African society, wherein you'll find that in urban areas, in built-up areas, the networks, the systems, the platforms, as well as the ownership of devices by individuals are actually quite high. But
I must say, Dr. Wiseman, should a country not perhaps create measures and put together systems in place that are compliant or congruent with their level of development? I mean, we haven't always had smartphones, we haven't always had advanced technology, but we certainly always have had people who were marginalized and who were on the fringes of the economy. Surely this could have been contemplated and measures then put in place to say, how do we get hold of people in rural areas? How do we get hold of those who need this the most?
Yes, actually, you're quite correct. However, when we go back to the time when President Ramaphosa announced the 350 grant, this was a time during lockdown where businesses were shut, where there was an economic shutdown, and many services and facilities of government that people and citizens normally go to for services were not available. Therefore, what then happened is that it became clear to government that because of the loss of jobs arising out of the economic shutdown, there has to be assistance. Now, we need to look at this along the lines wherein you don't do anything and South African citizens suffer, or you do your utmost best to cover everyone. Unfortunately, the circumstance of COVID-19 was such that SASSA could not receive applicants to their offices as they normally do, and they had to design online digital platforms that used predominantly the cell phone and internet for applications. Therein lay the challenge that not everybody in the country had access to cell phones. Therefore, when one looks at the fact that this is one of the aspects of the research that my company conducted, this is one of the things that we looked at about the implementation of the COVID-19 grant. SASSA moved from a point where there was no system in place whatsoever. SASSA has never used online digital platforms. This was the very first time. However, they were able to register upward of 6 million people upward of 6 million people in about 4 months. Yes, it is true that there were those then who were left out because they do not have the services and access to the devices. The question is this: were there ways in which, under COVID lockdown, SASSA would have sent people to people's houses to go and register them? Fact is, that was not possible to do.
So let's move on then from the 3 million that were left out and focus on how many actually did benefit and how were those funds then utilized by the beneficiaries?
Thank you very much. When the Department of Social Development commissioned this research, the aim, as you correctly pointed out at the very beginning, was to look at the utilization. What is the grant being used for? And secondly, the implementation, to evaluate the online digital technology systems that SASSA used, if indeed they excluded people. Now, starting on the utilization, the use of the grant, what was the 350 rand used for? The research that we conducted, and this research is based on a representative sample, therefore it's conclusive. The research indicates that 93% of those who received the grant used it to buy food. 93% used it to buy food. That kind of research finding confirms a number of other research pieces of work and studies and analysis that has been done in South Africa and elsewhere in the world, that those who receive social assistance indeed use it primarily for food, for positive educational outcomes, and positive nutritional outcomes. Therefore, 93% used it to buy food. Also, when you then ask the question, how many did apply and how many qualified, a total of 9.5 million people applied, and of those who were approved, that is, whose grants were paid, it was 68% of those who applied, and those that were rejected were only 32%, using the criteria that SASSA had put in place. So that's what the research established. Further, as well, two very important findings are really that 70% of those who applied are below age 34. Therefore, they fall in South Africa in what is called the youth group, between the age group 18 and 35 years. It is 70% of them who applied for the grant.
And in just 30 seconds, Dr. Wiseman, that last point, what was the third one?
The third one is that 70% of those who received the grant had matric or higher in terms of qualification. And one very last, very important finding from the research is that the grant was received by people who belong to households, and the size was a minimum of 4 people. 70% of those who received the grant are in households with 4 or more members of the household. Those are some of the key findings of the research.
Dr. Wiseman Magasela, thank you very much for your time. He is from the Research Policy Development and Advisory Forum, Clermont Analytics.